So at this time, I'm going to hand the conversation over to Dawn Grenzer, and she is going to introduce our guest for today and get our conversation started.
All right. Well, welcome everybody. It's exciting to see everybody on today and wanting to learn more about the particular career path that we're highlighting today. So, I am Dawn Grenzer with CISA 6, the College and Career Readiness, and I am excited to introduce Patrick McGinnis, and I will turn it over to him to allow him to tell you more about himself. Patrick?
Awesome. Thanks, Candace. Thanks, Dawn. Welcome, everybody. Thanks for being here this morning. Like Dawn said, my name is Patrick McGinnis. I'm the manager of rehab services at Calumet Hospital in Chilton. We're a critical access hospital. We're part of Ascension, which is a much larger hospital system. I have been a therapist for 24 years. I have been a manager of this department for 12, and I still treat patients. Most of my time is spent, I manage other departments at the hospital. So I also manage our respiratory therapy, cardiac therapy, and all the specialty services and the doctors that come in. So I have a bigger scope of responsibility at the hospital than just therapy, but I still treat patients almost every day. Just about myself, I did my undergraduate work at UW-Oshkosh, and I majored in chemistry and criminal justice, actually. And I did my graduate work at Washington University in St. Louis, Missouri. I worked in St. Louis after graduation, so I was there for about 5 years, and I've worked in a general outpatient clinic. I've worked in inpatient rehab hospital. We practice just with traumatic brain injuries, strokes, like usually serious long-term injuries. And then I've also worked here. I work in outpatient acute, outpatient general. We do some sports, and I also do inpatient work here as well. So it depends on what the caseload is. All the therapists at my clinic do inpatient and outpatient work here. So I'm just going to go over today to talk to you guys about what we have at our facility here, and also give you an idea of all the careers in rehab in general. And this is not all encompassing.
Patrick, before you get started, I just wanted
Yep.
to also, students, if you have any questions as Patrick is talking, please utilize the chat tool to post any questions, and then I can facilitate those to Patrick to answer as we move through the presentation. All
Yeah,
right.
to Dawn's point, please do. I mean, I'd rather answer questions than talk. So this is my hospital. At my hospital, we have 4 service lines. We have athletic training, occupational therapy, physical therapy, speech therapy, and there's also rehab psychology, which we have at one of our sister hospitals. Then I'll kind of talk about each one of those. So I have 2 athletic trainers at our facility. We cover 3 high schools. All the rehab therapists here are basically, we're all off the same genre. We're on different paths, different career paths. Occupationally does a little bit of this, physical therapy does a little bit of this, and licensed athletic trainer, we all specialize in something a little bit different. So for our athletic trainers, most of the programs for schooling they are through a master's program now. It used to be a bachelor's program. Now most are masters. Same with occupational therapy. So if you guys are interested in doing this, I mean, high school classes, it's sciences. It's about it. Kinesiology, physics, chemistry, biology. So basically the job duties for these guys and women, I should say, are, I mean, they're healthcare workers diagnose. You can read the screen. They help diagnose basically muscle and bone issues, but they work out at our high schools, but that's not the only place that they work. About 50% of all athletic trainers work in a setting outside of high schools. Most people see that's where they work, or they look, you hear the athletic trainers come on the football field for a Packer game. Most don't work there. Most work at larger organizations. Maybe they work at in Chilton, to be like a KT product, so they could work at Humana. We have a group of industrial therapists that work at one of the window manufacturers in Wausau. They work with industrial patients. Those are their patients. They do job analysis and job reviews. They have a huge scope of what trainers can do once they graduate. A lot of the trainers that I have here, obviously they work in schools, they work after school. It's kind of like working second shift. Good news is we get summers off. That's when they take most of their vacation. So it's kind of nice. But in the industrial setting, I mean, they're working 9 to 5. It's a different caseload. It's a different mix of people. It's a very interesting setting, actually. I've worked in it briefly myself in St. Louis at the Ford Motor Company. So it's an interesting group of people, but the job itself for athletic training is very dynamic and it changes a lot. So if anyone's looking at going into that, I mean, you really look at just beyond the sports in schools or colleges. And as you move up the food chain for athletic training, those jobs get harder and harder to get. So you don't notice that a Packer team, when the coach gets fired, they usually take their athletic training staff with them because generally they get fired as well. So keep that in mind. One of the other groups we have is occupational therapists. So as far as Athletic training will work more on sports and industrial settings. Occupational therapy works more with your activities of daily living. And that's, can you brush your hair? Can you get on your shoes? Can you get dressed? They work a lot with more of cognitive issues than a therapist or a physical therapist or an athletic trainer would handle. They do a lot more cognitive tasks. When people ask me in the hospital what their difference is between PT and OT, I tell them that I'm the guy that's going to get you up and make sure you can safely walk to the sink. And OT is going to make sure you can brush your teeth and you're not using your comb to do it. There's a lot that they do. Our occupational therapists here as well, they also work with everything from the neck down. They also specialize in hand and upper extremity, any injuries, crush injuries, any surgeries. They do both. Plus they treat the inpatients at the hospital as well. And we have at our hospital anything from general surgery to joint replacements to strokes to brain injuries. We get kind of everything in our hospital as well. So it's a pretty well-rounded clientele that you're going to have, and that will vary in your setting. I mean, there's a lot of different settings you can work in. I'll talk about that for therapy as well. Schooling is the same, basically for PTOT and speech. Schooling is the same. So if you start your high school class, and I encourage you now, if you're looking at going into any one of those professions, any classes you can take that qualify for college credits, take them now. It saves you time, because if any one of these programs, and I just know PT in particular, that any one of the programs that once you go to college for 4 years, then those programs are about 3.5 years after that. So if you can get out of college one semester early and get started early, I mean, it makes a huge difference in your timeline. So I really can't, I'm sure Dawn talks about this with you guys, but I can't emphasize that enough. Get done and get to work. So as soon as you can get your classes in before you get to college, I wish I had back in the day, I don't think we had that many. The sooner you can get in and get those classes rolling, the better off you're going to be in the long run. So I encourage you, it saves you a ton of money as well in college costs, which will come back to haunt you. I mean, that's a huge issue now, even with our political landscape of trying to cancel out school loans, where I would love to apply to get my school loans that I've already paid off canceled. So it's a big deal, getting out of school with $100,000 in debt and you're making $60,000, $70,000 a year. It's going to take you a long time to make that money up. So keep that in mind. So this is obviously my favorite. This is physical therapy. So in a nutshell, I have on here, basically physical therapists help people who've been in accidents, sports injuries, work-related injuries. There's a million different techniques that we use, from manual therapy, therapeutic exercise. There's modalities, there's dry needling. There's a ton of techniques. The classes are the same. I mean, physical therapy alone works with, you can specialize in sports. You can specialize there's a whole women's health section on pelvic floor disorders. There's vestibular problems. We have a whole group at St. E's, and then we have one at our hospital that work with just oncology patients. There's literally a plethora of jobs out there that you get into the profession, then you find something you like and specialize in it. As much as I tell the students that come in, we take a lot of students at our school or at our hospital, probably 4 to 6 a year. You want to be well-rounded, but you also want to, when you get done, pick something. Specialize, and I have people here that do dry needling, vestibular work. One is a Parkinson's specialist. One does geriatrics. I'm working on somebody get pelvic floor disorders. We have vestibular issues. I mean, there's a lot of different things we work on. One does just driver evals. One is a cognitive specialist. I mean, so we have a lot of people that specialize in something. So regardless of if you're in therapy, or even if you go and decide you're going to go into nursing, same thing. Be well-rounded when you get there. But then when you get into that profession, pick surgery, pick wound care, I do wound care myself. That's one of my specialists. I'm certified in wound care. Pick something and be really, really good at it. You can be well-rounded in your profession, but then pick a specialty. It'll help traveling, makes you more marketable, and the quality of care that you'll deliver will be better.
Patrick, I'm going to just interject
Sure.
right now. It's a really good question. You talked about classes that students can take and really help them to get a jump start and explore this career path. And then once they're in, identifying kind of that specialty. But what are some personal skills should someone have to be successful in these jobs?
I get this question often because I do medical explorers here. The big things that I talk about for therapy are traits that you have, and I'm going to go back to what Candace talked about with sense of humor, and you can work on that. Just because you put yourself down as a 0 today for sense of humor, I don't believe that. You can actually work on being funny. And one of the biggest attributes I look for in our students is to be astute. And I'll use a definition that one of my professors used is anybody can be up to plate playing baseball and anybody can watch the pitch, but it's the person that can see the rotation of the ball that's going to be a great hitter. So if you step that forward into therapy, I can see someone walk down the hall, but does he have varus or valgus in his legs or his ankle? Does he pronate? Does he supinate? Does he not have hip flexion? What's his cadence? So to dive deeper into that, and that's even I talked earlier about I majored in chemistry and criminal justice. There's a detective work aspect to it, which I think is one of the most enjoyable parts of the job. Is you get orders from doctors that'll tell you to shoulder pain, but you have to figure that out. So you really need to be astute in order to observe what's going on. The other thing is, I find the most important thing is to be intelligible. You are going to teach people something every single day. So you may have this wealth of knowledge, all this science, all this biology, all the mechanics that you have, but if you're not able to get your patient to understand what's going on, they're going to have a hard time recovering. So that's my top two things that I look for is, are you able to teach something? You have to be a great educator. So you really have to learn how people learn, which is really, really important. Being well-rounded, I know I talked about that before, being well-rounded is really important as well, and knowledgeable. Where like my job, I'm taking a class right now. I consider myself a pretty fair expert on knees and shoulders. They're two of my favorite things in wound care. I'm taking a class on knees right now just because I want to. And I realize there's some of the things I did 10 years ago aren't even applicable today. So everything changes. So you need to be knowledgeable and have that kind of that wealth, that search of knowledge every time you're doing it. I could like ramble on about a lot of these things today too.
They're great. Those are great.
Yeah. So, I mean, also to be the big thing too, as far as any of the therapies that I talk about is to be flexible. Everybody talks about, I like to take care of patients and do this, but you need to be flexible, like really, truly take a deep breath, flexible, because you'll go down to the inpatient unit and you have a schedule and that patient's in radiology and nursing's in the next room and the other one's getting blood drawn. So you have to change what you're going to do. Outpatient, your computer goes down today, somebody comes in on the wrong day. That's every day. So you really need to have a flexible personality, be able to just stop, take a deep breath, and move on. But the pace of occupational therapy, I think, is a smidgen different, but physical therapy is quick. You have patients scheduled every 45 minutes and you're moving. I mean, you're moving all day long. I don't ever have a day where I'm like, gosh, it's only 2:00. It's like, holy cow, it's 3:00 and I got 3 more things I got to get done yet. So it's a really good pace that you work at. So you have to have that kind of innate attitude of, I'm ready to attack this day every day. No day is slow in therapy. Like no day ever drags on. I cannot, even on a Friday, work doesn't drag on. So speech therapists or speech language pathologists, same classes, high school science classes, college is the same. The graduate programs are different. These are mostly master's and doctorate programs as well. Their job duties, they'll actually work a lot with our ENTs, which is ear, nose, and throat doctors, to do swallow studies. We'll do fluoroscopies where you can actually watch someone swallow live on camera inside. It's kind of cool. It's like taking a live x-ray and you get to watch. They work a lot with cognitive issues, and they also work a lot with just swallowing disorders. If you have a stroke, they work with a lot of oncology patients who end up with throat cancers and have issues swallowing, a lot of nutritional aspects and a lot of cognitive aspects. And when you look at the last one I have in here is rehab psychology. We have a rehab psychologist on staff at St. E's. She deals with, I mean, basically it has on her, she deals with individuals who are having troubles dealing with their own disabilities or any chronic health conditions. So there's always an aspect when I talk about being intelligible and knowledgeable and being able to educate your patients. This is something, if you have a hard time and that person has a hard time understanding or accepting what their diagnosis is, we send them to rehab psychology. So big picture wise, when you look at all these professions, the most is probably like physical therapists. Even in my hospital, we're a very small hospital. And anybody who's around here will know it's not a big hospital, but we have 4 physical therapists, 2 occupational therapists, and a speech therapist, and 2 athletic trainers. Generally, in any hospital or setting, you'll generally have more PTs, a little bit more than OTs, always more than speech therapists. When you think about what are my job opportunities, there's always more physical therapy jobs than there are occupational therapy jobs, than there are speech jobs, than there are rehab psychology jobs. Like in all of our 3 hospitals in the Fox Valley, we have 1 rehab psychologist. We probably have 8 speech therapists, and we probably have 60, 70 physical therapists. So that just gives you an idea of when you're applying or looking at careers, what you want to look at. I mean, there's a lot of programs in our state that you can look into, from Milwaukee to Madison to La Crosse, public or private. The cost varies. It's a lot of money. I would tell you it's worth it. I mean, I really, truly do love my job. Part of the management stuff always gets a little dicey, but as far as just the days where I come in and someone's on vacation, I just have patients. That's an easy day. That's just treating patients every day. So that's the best part about my job. The management stuff is different, but you'll never be bored. Every day is a new patient. Every hour is a new patient, a new diagnosis, a new treatment. You're going from backs to hips to knees to we have jaw pain or ankle injuries or broken legs or car accidents. So the range of and the scope of patients you have is huge. Almost in any setting that you get into.
Patrick, we have a question kind of
Yep.
as you were, and relates a little bit to what you had just mentioned about, what does a day in the life of a therapist look like? So a little more into how many patients do you see on a typical day? Obviously,
Sure.
you mentioned about being flexible and other departments may kind of drive your schedule, but on a typical day, or could you kind of talk in general terms?
Sure. The crummy answer of that is it depends. So there's like from my day, you can have anywhere from 8 to 12, maybe you'd have 14 patients would be a lot. And I'm talking that's in an 8 to a 10-hour day, depending on what we have to do that day. But there's different settings, and that's pretty normal for any therapist anywhere in an outpatient setting. If you're just in a strictly private clinic outpatient setting, that's a whole different pace as well. And you'll be seeing maybe more patients than that. It gets hard. Our hospital, we really lock down on you don't overlap patients. Everyone is seen one-on-one. But that's a normal day to see anywhere from 8 to 12 people. Depends on the setting you're in. There's a lot of different settings you can work in all of, PTOT primarily, where you can work in schools, you can work in an inpatient rehab hospital where you, like I talked about, dealing with traumatic brain injuries. In there, you may only see 6 people a day. You can do home health, which is popular. Do you work in everybody's home? There, you may only see 5 patients a day. That's your whole day. You may see 4. That's your whole day. And those 4 patients may take you all day. But schools, it varies. In an inpatient setting, you're going to have not quite the same as you would in an outpatient setting. Maybe you have 8, 10 people. Depends on how many evaluations you have. But I mean, when like we walk in a day, I get in at 6:30. My staff we work 5.5 days a week. If somebody works part-time on Saturdays, just for inpatients. Outpatient, if you see just patients coming in from the outside, you really don't work on Saturdays. Most clinics don't have Saturday hours, some do. But your day starts, 8 o'clock and you'll have a patient and they're scheduled out like literally like every 45 minutes, a new person starts. So talk about being organized and being ready to roll. Most of my therapists will look at their schedule, and I'm one of them. I look at it the day before, so I know what's going to happen the next day. You don't talk about being flexible, but boy, I don't like surprises. I don't like coming in the next day and realizing that, and it happened today already, where somebody came in on the wrong day and they don't want to come back. And so you have to be flexible, but the date changes, but it's a very quick pace though. Does that answer your question?
Yes, it definitely does. And obviously, depending upon what type of therapist, like you had referenced, it could look a little bit different.
Yep. So I mean, to talk about like the different settings you want to work in, because just because you do, I'm going to use physical therapy as an example. The rehab psychology and the speech, probably not as much, but the PT and OT, I mean, you can work in a skilled nursing facility, a nursing home, inpatient long-term rehab, like with brain injuries, things like that. You can work a general outpatient clinic, where it's very, very, very fast paced. You could work in outpatient hospital, which is about as fast as that. You can work inpatient hospital. You can work in an industrial setting. Like even in our area, KT has a therapy in our town here. Sargento has therapists they contract out. Stolting in Kiel. I know guy from Sawyer doesn't understand this, but all these businesses, they have their own therapy, their own hospital staff that come in there. So you look at, the employees there as those are your sports injuries. They're just your work injuries. You treat them like any other athlete. They're just a work athlete. You can work as travelers. We've had a few here over the years. Usually I get a traveler, and I'm going to get one next month because we're going to have one of my OTs is having a baby. So she's going to be gone. So we'll get travelers, and they're usually younger, mid-experience level, but I mean, they go all over the country. I mean, they'll go from here. Tomorrow they're going to go to Alaska for 13 weeks. And you normally work a 13-week stint, and those people will do it and they'll love it. They'll do it for years. You make a lot of money. You have no overhead. You have no housing to pay for. You can make a little more than the average therapist, but you have no expenses. You usually get a food stipend, a house stipend. So it's kind of nice. And you can travel almost anywhere in this country, especially the South and the West and Northwest. It's a lot of need for travelers. A lot of people are moving there. So there's always a huge demand for therapists. There is in the Fox Valley as well, but people generally don't move away from here. So, I mean, if you guys, anyone willing to move at all, your job prospects just skyrocket the farther south you go. It's a bigger population centers, but you can get a job anywhere, any hospital, almost any time. So that I know, I always get asked about how much money do you make? So I don't know if anybody's interested in that. And you guys can Google it. It's nothing that's too extraordinary to find. But I mean, we have PTs and we have physical therapists and physical therapy assistants and the occupational therapy and occupational therapy assistants. One's literally a 7-year degree and the one is a 2-year degree. So I mean, you could be a PTA and be a 2-year degree, and you can be a physical therapy assistant and still make $50,000+ a year easy. And if you travel, you make even more. So you can, same thing with being a physical therapist, and that ranges from starting out in the mid 60s or so to you can make $100,000. Depends on what setting you're in. If you work in like a nursing home, you get paid more. Look into that. I have a lot of friends who did this out of school, that they went to work in a nursing home right away because you make more money and you can pay off loans faster. So I'm sure you guys talk about this, but really my soapbox is think about what you're doing, because you don't want to collect that money. Your education and what you pay for it is like a credit card. That bill comes due and there's interest to be paid. So keep that in mind.
Do you see PT assistants, becoming a physical therapist assistant and then getting a job working and then continuing on to become a physical therapist? Or do you not see that too often?
Nope. And we don't see that very often, actually. Most people you'll see it sometimes in nursing where you have a CNA and maybe they'll be an RN. But for PT, no. In occupational therapy, no, we normally don't.
And what does the difference between an assistant? What are their tasks?
Ultimately, the physical therapist is responsible for every single thing that happens to that patient. So when you come in and whatever it is, if you have knee pain, you come in, the doctor has an order, and in Wisconsin, we can see people right off the street as well. You'll do the evaluation, you come up with a plan of care. This is what I think is wrong. This is what we're going to do. This is for how long we're going to do it. Develop the exact plan of care. We're going to do these things. And then it gets turned over. Like a lot of our surgical knees and hips go right to our PTA. She's been doing it for 20 some years. She's phenomenal. If she makes a change to that plan of care, she has to let us know. We have to actually sign off on that note that she changed the frequency, whether she adds, not so much just an exercise, but if she changed frequency, or if she changed how long we're going to be seen, or if she's going to add on some modality, we have to approve of all of that. So you're basically in charge. And I have patients that I eval once and I never see again, because she'll take them over and she does a phenomenal job, but I'll never see them again, except if it's Medicare every 10 visits, and that's just a guidance issue. So but they do a lot of the same jobs that we would do. I mean, I do notice a different skill set. I mean, you have, 4 years of college, and then you go to 3.5 years of school, and now everyone's a doctorate program for physical therapy. There's a higher level of learning. There's a higher level of like the gait mechanics and the evaluation and this. So there's the educational level is different. You can still make a great living being a PTA, but you'll notice the educational level, even the difference between like, an RN and a CNA. I mean, she knows a lot of stuff, but the RN knows way more stuff. That's just education level. So
Got it.
same thing for CODAs. It's the same thing for the occupational therapy assistants and the occupational therapists. But they just kind of take over your plan of care that you have to develop, and you're responsible for everything that they do and everything that you do. So there's some therapists that really don't like to pass anybody off. They don't trust anybody to do that. But we have, our physical therapy assistant, Christine, is phenomenal. So she's been doing it longer than I think almost any of us. So she does a good job. So. And the pay, like I said, the pay scale is great, and it's a 2-year degree. And you think about career paths and like, do you want to get out and make this much money in this amount of time, or do you want to spend 7.5 years in college creating debt before you make more money? It depends. Really do the math on it and see what you want to do.
Are there more opportunities for assistants than there are for the therapists? Or are there more therapists than assistants?
There's more therapists and assistants. Like even here, we have 4 PTs and a PTA, and it depends on your setting. But even in like over at the Milky Way clinic, they probably have 20 PTs and maybe 2 or 3 PTAs. It's just the difference. You'll see more PTAs and more occupational therapy assistants in a nursing home setting, where they'll get a lot of nursing homes. They'll contract out their therapy to a company around here. They use Greenfield. They'll have a traveling physical therapist or a traveling occupational therapist that goes to 4 or 5 sites, evals the people, and then that plan of care gets taken over by, a PTA. That's where that group is used the most.
All right. Thank you. A couple minutes left. Was there anything else of your slides that you wanted to share that we didn't get to? Otherwise, I have a couple more questions for you.
Nope, I don't. I just have these slides. This is my last one.
All right, perfect. One of the things that obviously as a youth apprenticeship coordinator, I'm always looking for opportunities, but one of the questions, what can we do to help students or young adults to get their foot in the door, to be exposed to therapy services, to help build that skill set as they continue through high school and maybe move into their college setting?
Most of the people, even the students, and I did this when I went to school, I actually volunteered here at Theta Clark Hospital in pediatrics. So I was there for years, even if it was one day a week, to really get exposure to see how it works. And pediatrics is a whole other ballgame. I could have put that as a different specialty. Obviously, that's a whole other, and I don't work kids, that's too much for me. But to get out and to really to contact the school, we do job shadows here. We have kids come in. We have volunteer experience. We have had 2 volunteers last year, 2020, we didn't. But in 18 and 19, we started a program. We have volunteers that come in. They just worked in rehab. They help to clean stuff and room patients. Both of them are physical therapists. Both of them went on to school, and they're both, one's in Minnesota and one's in Michigan now. So they both did a great job. But we have that. We have job shadows that come in all the time. We'll also have the capstone program that runs through school. You can get in that, and then we'll actually move you around, which I like the program because then you can move around to different departments. And if you're really into radiology and you want to do this or do, mammals or anything like that, you can spend a day in there and learn that, and you can watch their process. Same thing with us. You can do the same thing with nursing. And I really encourage everybody to get a hold of your local hospital or your guidance counselor. I think you could probably help a lot, but get to the hospital, get to any hospital, get to more than one. Go to a clinic. If you went to any therapy clinic and said, hey, can I just sit here and shadow? They'd be like, sure. I can't imagine anybody would not want you to get in there and work with them. And you can't, do anything with patients. You can see how the day rolls. You get a better idea of the pace, the opportunities, the patients that you have. Because, it's a big commitment. So, you really want to have a good understanding of what you're going to be doing on a daily basis.
Do you recommend students that are thinking about going into careers within therapy to get their CNA?
I did. I was a CNA for about 2 years. I still, to this day, it is the hardest, most miserable job I've ever had. It's just everybody's your boss. It's a difficult job to have, but you will be rewarded with an understanding of healthcare, especially if you end up working in a hospital. Nobody else, no other therapist will even appreciate. Even when I was in school, I was helping our students. We were allowed to go into the hospital, Barnes Hospital in St. Louis. I was hiring people and moving people around. They're like, what is this guy? I'm like, I've been an aide. I can do all this stuff already. So you'll actually be ahead because a lot of those things you'll have to help with, you learn in CNA school. Even the RNs don't learn all that stuff. CNAs do all the work. They're the backbone of the hospital. So they do all the work, and to get that job doing that, even in a nursing home setting, it's a huge benefit to your repertoire and your level of knowledge, and to be well-rounded. Those are some things you can really use and bounce off of that to be a better therapist.
Wonderful. Thank you. You did a great job really answering what students can do while they're in high school, the classes that they can take, opportunities to take advantage of. Obviously, the job shadowing and volunteering are great things. Ironically, a number of our students need volunteer hours for graduation. So that could be, something that they could maybe incorporate in that, and also help them identify, if this is a good career fit for them. So Patrick, thank you so very much for your time and all of your information. Sure. I definitely am going to walk away with a better understanding of therapy services and feel very lucky to be able to help my students that I work with. So thank you very much for your time and your information today. Students, thank you so much for hopping on, and hopefully you found that this is helpful. Again, just a reminder that if you had any other questions as you walked away today or wanted to explore more careers within the therapy services, to make sure that you hop on your Zello account. So thank you very much, everybody. And that will be a wrap for our career experience today. So thank you very much.
Awesome. Thank you very much.
Bye, Patrick.
Bye.